if you go into the waiting room and you're like, oh my gosh, look at all of these people, or if you're waiting for what you feel like is an extended period of time, just know that sometimes it's not the fault of the provider. There's so many different things that's involved in the dynamic of the time that you walk into that door to the time that you're actually seen and out the door. But just try to be patient. And if you are finding yourself getting upset, just don't take it out on your provider. The second one is, when you are talking to your healthcare provider and maybe you want to question something they have told you, please, please, please don't say, well, I was looking on Google. Don't start with that. Another alternative to saying I was looking on Google could just be, upon further research, and I was doing some research, and that might be a little more well received. Third tip is, if you have 7 or 8 or 9 or 10 different areas of discussion or problems you're having or complaints, I would gently suggest that you pick your top 3 or maybe even your top 2 for this particular visit to address, the ones that you feel like just need to be addressed, the most important ones to you, and try scheduling another appointment to address the rest of them. The next piece of advice is, hey guys. Great. Next one is just simply smiling. When you are sitting there and you're waiting for your provider to come into the room, just simply saying, how's your day been so far? They don't want to really engage in that because maybe they're really busy. And if they just say, it was fine, the fact that you just set that tone, because chances are the patients before you probably did not ask how you've been doing, because of course, like I mentioned before, patients, that's not your job. Patients typically aren't showing up and checking on their healthcare providers. But as a healthcare provider, I will tell you that it does mean a lot when a patient says, how are you? Okay, and then the last tip today is, be okay with reminding your healthcare professional. Sometimes patients, because they think the world of their provider, thinks that maybe your healthcare provider remembers back in 1997 when you broke your left arm and you had a weird reaction to, the medication that they gave you. I'm going to let you in on a secret today, okay? Lean in and tell you a secret. They probably don't remember that at all. If it's documented in a chart, then, which it probably is, you would be assuming that your provider all the way back through your charts back decades ago or 10 years ago or 5 years ago to remember the little details. So if it's something that's important and relevant to the visit today, it's okay. Remind them and don't hold it against them if they don't remember, because they're probably seen like thousands of other patients since that has happened. So again, these are just some little tips, and there's ways to be nice, because knowing the numbers, as I said in an earlier post, it's tough out here in these healthcare streets. And your healthcare providers are doing their very best to try to take care of you with the capacity that they have been given. And part of my job is to help remind our healthcare professionals that it's okay to take a break. It's okay to get help. It's okay to feel stuck and do things to make yourself unstuck.